Hi everyone. We're here to present PISGAH. PISGAH is an AI native electronic medical record system, and we're just going to go through the entire workflow. So this is a hospital. This is seen by the CMD, so you can see your bed capacity, the longest wait. Remember, the idea of PISGAH is to reduce the time that patients go through each step. So from the reception to the triage, So this is the longest wait in the hospital that the CMD can see and track what is going wrong. So number of staff on duty, revenue leaking, the different departments in the hospital. So we'll do a typical flow. Reception, let's pick a patient that is returning. And the moment the reception is done, the triage gets information on the patient immediately. You can see the name here and just now. And then we'll do this 120, 80, 90, 24, 200, 180, and then 30. So you can make any note to patient, then route to the doctors. So the moment you route that to a doctor, the doctor will see the information. You can see the names already here, and we can start a consultation. Very simple. We'll start a consultation right now.
Hello, good evening. What brings you in?
Yeah, I had an accident, a minor accident. I sprained my ankle. I fell down from a staircase, so I sprained my ankle. So yeah, it's been painful for like 2 days now.
Okay, but have you been able to walk on your own?
Manageably, but yeah, I had to come so we could check it and see if there's anything wrong.
You taking any medication?
No, nothing.
Okay, I want to do an X-ray of your
Okay.
leg.
Yeah, sure,
So I'll
sure.
do an X-ray, and when the results are out, we'll get back to you.
Okay, that's
Right.
fine. Thank you, doctor. So right now the note is being prepared. So it takes all the contacts again from the reception, triage, everything that's happened essentially, and put it together with the conversation we just had, then create the note. Okay, so the note has just been created, and you can see reason for contact, social history, current medications, physical exams, no physical exams, of course. Then differentials. Differentials like from the most likely diagnosis to the less like or unlikely rather. So you can order a test, whatever test you want to order. You can prescribe medication, admit the patient, and then yeah, you can create order and sign. And that is essentially the very easy part. For all this information now goes to the lab, and then the lab can take the samples and do the test. The pharmacy does the same thing. So everything is processed on the same patient record. For management of insurance, we have like an HMO page that manages how we handle insurance claims. So the AI agent takes all the details of the agreement between the HMOs and the hospital and handles the submission as well at the end of the month automatically. Then you have mission control. All these are basically administrative stuff that the hospital could use to like manage how much they lose, how much they make, management of staffs, and essentially everything. So yeah, that is pretty much everything about this guy. There are other very nicer features, but essentially this is the end-to-end flow. We try to use AI agents to manage repetitive tasks and make it easy for the entire hospital, to operate.